Welcome to my health lesson. Today I'll be talking about fistula, fissure and piles. These are very critical diseases. You will suffer a lot if you have ever developed this. There are basic differences between these three. I'll be talking about a lot of things here. Hope you'll enjoy and learn a lot so that you can get rid of these difficult diseases. So fistula and fissure are very similar. Basically they are the same disease, but in the beginning, fistula is different from fissure, and you usually have it in anus. That's why it is called anal fistula or anal fissure, right? So here you have very similar things. Basically, this is an abscess, right? And this is the cuts, micro cuts. When you have constipation, you will have a lot of cuts because it's difficult to get your the stool pass, right? But piles different. It is a lump of flesh inside the anus, right? Inside the anus you have a lump of flesh. If you have this and if you get it operated, then there will be a machine, and the machine will insert a trap, something like that, and the machine will squeeze the trap, and then it will squeeze and it will cut by this trap, right? So this is basically never curable unless you have operation. But this can be cured, as I cured my fistula after 5 years. So it's a kind of serious disease. Here you have a serious problem, that is you have a lot of pain. So pain is very common in this fistula, right? So pain, severe pain in fistula and in fissure. But in piles you may not have pain, but the thing is that you will have blood. So in case of piles, you will have blood while you are having toilet, right? When you are using toilet, you will have blood. In case of fistula fissure, you can also get some blood when you are passing stool, right? This is possible, but likely that piles, in case of piles, a lot of blood. This is very common here. All right. So this is basically an abscess. You have 19 pair of glands, right? You have 19 pairs of glands, and one of the glands may be infected. When it gets infected, it will develop an abscess. And when you have it, you will have a lot of pus in the abscess, and the body will not scrape the pus, so the body must push it out of your body. That's why how can it go out? Because the abscess inside the skin, inside the skin, under the skin. So what will happen? You have suppose you have anus. This is the mouth of the anus, and here you have the cavity. Here there may be an abscess, as the inside is very soft and the outside layer is hard. That's why the pus is trying to get out of the body inside the cavity, because the layer inside the cavity is very much soft. This is something very important here, and that makes the situation much worse, because when it's ruptured, when it's broken, the pus will get out and stay inside the cavity of the anal cavity, and there your stool is passing, and there is connection, and stool is full of bacteria contamination. So when the stool touches the mouth of the abscess, the pus, there will be a lot of pain, lot of burning, very, very severe burning. Sometimes it's not severe, but most of the times it is severe, and you have to go for sitz bath. Sitz bath, warm water, warm water. So you will have a bucket of warm water and you will sit there, top. When you sit there, it lessens the pain of the burning. It's horrible, right? But in case of piles, you may not have sensation, pain of burning, but in case of fissure and fistula, right? So as I told you that basically fistula comes from this infection. There may be at one of the 9 pair glands, and as it gets infected, it develops pus, and when it has pus, the body will get it away, and that's how there will be an abscess form, and there will be a mouth of the abscess, and the mouth of the abscess will rupture, will break, right, will open. When it opens, the pus moves, so the pus gets connected with the stool, and the passing of the stool can also hurt the abscess, and that is how immediately you may not have the pain, maybe 30 minutes later, maybe even 1 hour. Even it happens that after 3 hours the pain starts. When the pain starts, you'll go for the sitz bath, you go for the warm water, so that you can also use Epsom salt. It can be normal salt at the same time. Epsom salt is even better. It doesn't matter for a girl what happens. Salt may be a problem because you have vagina and you have anus together, very little gap. So when you have salt, there may be something wrong with the anus or the vagina. There may be problems if you have the salt. It depends. It doesn't much matter. In case of mine, I've seen that if I haven't used salt, it didn't matter much. Doesn't matter, right? So one thing here I'd like to talk now that's very important, as it is basically an abscess, right? Abscess. So what happens? Within 21 days, you have to solve the problem. If it crosses 21 days, it little by little gets longer, right? Longer. Maybe the abscess was like this, but now it goes higher, bigger, right? It can even move different ways. So that's called channel, right? It gets channel. Okay, so it's dangerous. So you have to have antibiotic in the beginning. If you understand that you have this problem, then you have to have antibiotic, and do not go for 7 days, do not go for 10 days. It may take 20 days, maybe 20 days, right? So what happens? You take time. If you do not know whether all the bacteria are gone, it means abscess full of bacteria, right? The pus means a lot of bacteria inside the pus. So when you have taken antibiotic, there is a common mistake. You stop it after 7 days or 10 days. Your doctor may also tell it for 7 days or 10 days. And then the thing is that you have found comfortable, you are quite okay. You find that it's okay, but it's not actually okay. There are some other bacteria remaining there. So it is better to have for long period of time in the beginning. Even when it's destructive for your body, antibiotics very dangerous for your body. It will kill gut bacteria. You have 40 trillion gut bacteria. These bacteria always kill the foreign bacteria, those who are from outside your body, those who are very harmful for body, right? So what's very important here is that do not take time when you have these symptoms. If you go to a doctor, the doctor may put the finger, or if necessary they may have machine, and they can be quite comfortable I mean, quite understand that you have developed an abscess. When you have the abscess and the mouth of the abscess has ruptured, they will give you administer antibiotics. So you will go for antibiotics. It's not healthy, but it's necessary because fistula, it will turn fistula. So basically, there is no fistula. When the fistula continues for more than 21 days, it turns into fistula. Same way, fissure. If you have constipation, when you have constipation, what happens? You have a very hard stool. When you have very hard stool, what happens? These pressures inside the, anus, right? And it may have tears. You will develop tears, you will develop microcards. It also happens when you have urine infection. A girl usually suffers from urine infection. When a girl gets married, the sexual intercourse is not actually properly done. Then what happens? A lot of friction in the beginning of a girl's sexual life gets a lot of cuts, micro cuts, very small cuts, even you can't see in your eyes. Microscope can help you see them. So the same way, what happens in case of fissure, as you have hard stool, passing stool gets a lot of frictions with it, and then there will be a lot of tears, lot of cuts, and they turn into an abscess, right? So when it gets becomes abscess, what happens? It may not get cured. In the beginning, may take medicine and it gets cured. In the beginning, may find that it's all fine, but in course of time, after 21 days, if it is not cured before, then it will get bigger and bigger, longer and longer than the channels. This is how the fistula will aggravate, will deteriorate. So what's advised is that you'll take antibiotics. If you can't help, if it is more than a month, then what will happen? You immediately have operation. So operation is a must. If you have an operation, it will be all over in the beginning. But if it is 1 year old, 2 years old, then the complicacy grows. The bacteria are getting more powerful. They are getting more and more number. Every 20 minutes, can you imagine? Every 20 minutes, bacteria gets double. If you have 1 million bacteria and 20 minutes later, it will be 2 million. Can you imagine? 1 million bacteria can get 2 million within 20 minutes. Every 20 minutes, bacteria will get double. So you have to be very careful in the beginning. It's very good to have operation in the beginning. And if you have an old fistula, what will happen? The operation may not get successful and it can come back. Fistula may come back. It happens that in America there was a couple, they were having interview. In a YouTube video they said that the husband or the wife, it's not clear, he or she had fistula and they went for 12 years, and after that they came to India and they had an operation in India, Sutton operation, and that's how they got rid of this. But basically in case of mine, I had no operation. It was wrong, but later I learned a lot. This may help you a lot. So after 4.5 years, I stopped medicine. Actually, in case of fistula, if you have allopathic medicine, it will not work. Allopathic medicine will not work. You can have homeo, you can have herbal, right? But it will not be more than 90%, maybe 80%, right? So when I had this medicine for 4 years, my problem was solved 80%, right? 90% solved, but 10%, 20% still remaining. So what happens when I have had a long time having medicines? I got impatient, and at one point I stopped medicine. I did not take care of my health properly, then once again it has boomed. It has turned into severe condition, right? Then I again had homeo herbal. It improves a lot, very quickly it improves, but it will never go away. So after 4.5 years, what will happen? I stopped medicines. When I stopped medicine, my fistula is gone. I have recovered from this kind of 8 months ago. Probably I am the only one person out of 8 billion people on earth. 8 billion people. Probably I am the only one person who without operations got rid of fistula. So that's why I'm trying to help you so that you can get rid of this problem. So how did I solve my problem? My problem solved because I followed lifestyle. I have a lot of videos on this lifestyle. If you maintain properly lifestyle, then fistula will automatically go away. All other diseases will leave you, will go away, right? So what I told you, that in case of fistula fissure, you may not have blood, not much possible, but if you have piles, you will have blood in your stool. But this is very easy but not curable. It will never cure, right? You cannot cure this. It's not possible in case of piles. But piles is much easier, not so difficult. This one is so heavy, so dangerous. Why? Because you have a lot of pain. But the thing is that without operation, if you follow lifestyle, you can solve this problem. But in case of piles, you cannot solve this problem because it is a lump, as I showed you. As it is a lump, right? It is a lump. You have to have an operation. The trap will be squeezed from outside by the machine and it will be cut. When it's cut, then the problem is solved. The piles have gone. Basically, I see that most of the people do not go for operation. They just try to keep their stool soft, right? Stool soft stool. This is a must. As long as you have a soft stool, it may not disturb you. So piles, maybe suppose this is your anus and piles is there, so it can come all the way even outside the anus when you are passing stool, right? And some people will have it pile outside, but they will go above. So this is anus, right? So what happens? This lump of flesh will even come out when you are passing stool, and when passing stool stops, then it goes up. You can't see. Some people have it all the time outside. If they touch finger, then they will catch it, right? And some patients do not have this lump outside the anus, always remains inside. So if it is your anus, then maybe 2 inches above you have this, right? This lump. It's like alveolar, alveolar. You have 2 tongues, this tongue, and you have inside another tongue. So as that tongue is there, you see the same thing will be there in your anus, anal cavity. So you have to have it operation. It's just a matter of 30 minutes. Operation is just money, nothing else. Anesthesia will be there, local anesthesia will be done. You can't find anything wrong. The machine will put the trap inside, and with the help of the machine it will be squeezed so that the lump is cut out. So after 30 minutes the operation is over, you are fine. You have no problem. You can go to job, you can come back home, whatever you are doing, no problem, nothing wrong. And in case of fistula, there's little problem. The earlier the better. If you have this within 2 months or so, then it's such a normal operation. The abscess will be cut, will be drained, will have the pus out of that, and there will be some gauze, something will be there, and later 1 day or 2 days or 3 days there'll be washing. So it's a little painful thing, I understand, but it's much better because you will suffer a lot all your life with it. So fissure and fistula the same, though the beginning is different. So if you are very foolish, then you will have hard stool. If you have hard stool, what will happen? The fissure, because there will be cuts, there will be micro cuts, there will be tears, and when you have this, then they will turn into abscess, small abscess, and this is how what will happen. The fistula will develop. But in case of piles, you have these different, as I discussed a lot. That's it for now. Thanks for watching.